Salam, everybody. My name is Edoardo Conti, and I'm a director of a professional derma company. We manufacture Jالپرو since 2004 in Italy, and we have been working in amino acids technology since beginning of 2000 to develop different cluster of amino acids to treat different pathologies. So today we are here especially for the aesthetic medicine, dermatological part related to rejuvenation. So I want to thank you, all of you, for coming to attend this event. Thank you, Tebgostaran Soroush company, to organize the event. Thank you for all of you to be here. Thank you very much, Dr. Mansouri, to come to join us. And because I know it's a weekend here, you have a lot of work, a lot of families, and a lot of commitments. But thank you very much to be here and to. I will try to show some interesting scientific scientific data, and also to show a very interesting protocol of use for all our biorevitalization line. So I'm here for all questions you can have. I'm here available to answer, but I'm sure that our doctor today, Dr. Fatma Pelin Ozgen, she should be great, and she's very prepared about amino acids concept. She's been working for a long time with Jالپرو in Turkey. She's a professor in dermatology in Istanbul, and yeah, she's very experienced about the products, so I'm sure you can have an interesting session. So thank you again for organization, and yes, I introduce to you Dr. Fatma Pelin.
Thank you, Eduardo. Good evening, my colleagues. Firstly, Dr. Mansouri and all my colleagues, it's my first time in Iran. So firstly, I want to express my special thanks to Eduardo and all the Jالپرو team in Iran for their hospitality. And today, I will try to explain you my experience about Jالپرو products and especially Super Hydro. Welcome to our workshop, and don't hesitate, please, about your questions. And let's begin. May I have a pointer or something like this? Firstly, I want to introduce myself to you. Actually, today is my first day in professorship. It's really a surprise for me. Yesterday, my professorship was approved, and today, this is my first lecture, and this is my first workshop as a professor. And thank you again for joining my existence about it. And I'm a dermatologist. I have been working as a dermatologist for 15 years in Turkey. And now I'm working in a private clinic in Zorlu Center in Istanbul. And I was born in 1985. And my medical faculty was in Ankara. And I had my specialist education in Ankara also. Thank you. Then I came to Istanbul and worked as a lecturer at a university, Bezmialem Vakıf University in Istanbul for 7 years, and for the last 1 year I have been working in a private clinic, and this year I returned back to academy with my new title and began the things again. That was me. And now that's our topic today, about aging and about hyaluronic acid, amino acids, about the ligaments. As you all know, I know that today was a long day for all of you and you are tired, so I don't want to make you bother a lot. So I will try to summarize all the things, and I want your also contributions to the presentation. As all you know, aging is highly correlated to aging of collagen and connective tissue. It's a multifactorial process. It's about muscular hyperactivity, fat loss, bone loss. It includes all of them. As you all know, there are external stressors and internal disposable factors. External stressors are UV, pollution, diet, and stress. And our extracellular matrix modification includes collagen loss, hyaluronic acid loss, elastin loss, and all of them causes the aging. And we all know that connective tissue is one of the 4 basic types of animal tissue, like epithelial tissue, muscle tissue, and nervous tissue, and it develops from the mesoderm. It's found in between other tissues everywhere in the body, including the nervous system. They support and protect the body. All connective tissue consists of 3 main components. They are fibers, elastin, and collagen are all we know, the importance, growth, substance, and cells. For talking about collagen, the main component, it provides high tensile strength to the skin. The glycine protein hydroxyprotein sequence is vital for its structure. There are 4 types of collagen fibers. Type 1 is found in skin, tendons, bones, cornea. Type 2 is found in thinner than intervertebral discs, cartilage, and vitreous tumor of the eye. Type 3 is found in smooth muscles, lymphatic tissue, blood vessels, and bone marrow. And type 4 is found in basement membrane and lens. And let's talk about elastin. Elastin is long and thin branching fibers, and they are highly distensible. Elastin molecule consists of 4 polypeptide chains, which contain glycine, protein, valine, and alanine amino acids. It's found in skin, lungs, and blood vessel walls. Its half-life in healthy tissues is 70 years. And there are cells of the connective tissue. They are stationary like fibroblasts, or migratory like lymphocytes or macrophages. They are the cells. They are the actual fiber factories. Fibroblasts are undifferentiated, tenoblasts found in ligaments, chondroblasts found in cartilage, and osteoblasts are found in bone. And they stay functional until 80 years old. Here we can see the fibroblast. It can produce extracellular matrix, growth factor, hyaluronic acid according to the external factor. It can provide the other collagen fibrils or enzymes or elastin. And for talking about extracellular matrix, mechanical integrity consists of collagen. It gives the strength and resistance. Elastin gives extensibility, and hyaluronic acid gives hydration and cushioning. Fibroblast, as the former slide, is responsible for production of fibers, hyaluronic acids, enzymes, and growth factors. Macrophages are responsible for removal of waste and foreign substances. And we can see the connective tissue here. Epidermis, dermis, under the epidermis there is a subdermal plexus, and it's under the subdermal plexus there are stratum membranosum and subdermal vascular plexus and thickening of superficial cutis, and under this mass there is thickening of deep retinaculum cutis and suprafacial plexus. But they are dropping caused by lengthening of white lines. It It is because of the aging, and the white lines and ligaments by years, they begin to droop. And we all know there is a triangle in our face. This triangle returns back and reversible by years and by aging. Aging of extracellular matrix, aging of collagen in deep connective tissue is responsible for sagging, sliding, melting of fat compartments, wrinkles, thin skin, and lack of structures. And there are 12 or 15 kilograms of proteins in a human body, and half of this amount is collagen. Approximately 6 to 7 kilograms of collagen all we have in our bodies. Collagen is losing density and length with aging. As collagen is lost with age, skin is losing its structure. By the years and by aging, type 1 collagen decreases, type 3 collagen increases, and in our body and in our skin, it gets more fragmented collagen. But what is our objective as dermatologists? What are we trying to do? Our objective is maintaining collagen as long as possible. We are always talking about this, and today we will always talk about this. Fibroblasts need to be stretched. Why? Because collagen fragments are getting more collagens get more fragmented by photoage and age skin, but in photoprotected or young skin, there are stretched fibroblasts. And why collagen is decreasing? Collagen is degraded by an enzyme called collagenase. It's a metalloproteinase, as we all know, and factors influencing collagen destruction are age, photoaging, inflammation, glycation, imbalanced diet, glycine deficiency, menopause, and mutation and activity of these glands. When we look at this picture, we can see all American presidents. By years, firstly, at the first pictures, they look young, but chronic stress maintains the body into sympathetic mode, and where all resources are focused on emergency organs, so heart, brain, and limbs. And low-grade chronic stress leads to chronic inflammation. Long-term impairment of non-emergency organs linked to skin health are digestive system impairment, hormonal imbalance, and skin recycling. And when they finish their duty as a president, we can see how they get, unfortunately, aged by the years. And accelerating factors for collagen loss. I think you all know the first picture about photoaging, because this must be a truck driver, and he always gets sunscreens to right side, and there is no sunscreen to left side. So we can see the collagen loss and aging at left side, definitely. And the stress, Barack Obama and other presidents, and as we all know, all of us, by the stress, gets aging and lose our collagen. And inflammatory diets like dairy products, like junk food, and like the other inflammatory products increase the collagen loss. And diet can be an important source of imbalance and impairment of collagen production and quality by inflammatory diet and glycation. And lack of nutrients. We are talking about more and more leaky gut syndrome and dysbiosis recently. I think it's also famous in Iran, isn't it? In Turkey, it's really getting a very famous trend about leaky gut and dysbiosis, and under all the diseases, it's making some studies and functional medicine, we call it. I'm not sure, is it in Iran also, but functional medicine is getting a very high trend in Turkey because of the leaky gut and dysbiosis. And processed food and non-balanced vegan diet also increases the inflammation. And we all know the 40% of genetics and the 60% of lifestyle affects the clinical results. 85% of people have minor connective tissue disorders, but they don't know, and they have symptoms like hyperflexibility, evolution of skin mobility. And fibroblasts manage anabolism and catabolism. They are just factories. According to signals, according to stimulations, they can produce extracellular matrix, growth factor, hyaluronic acid, enzymes, collagen fibers, or elastins. This only according to signals. And amino acids are the weak link. There are for fibroblasts, we say they are factories, but if we don't give the amino acids, there is a weak link, so they can't get enough signals for stimulation treatment. But when we put the amino acids to this system, we can get the finished product, collagen, as a result. And the internal competition for resources, components of the extracellular matrix and collagen are used in other parts of the body. It's also found in cartilage, vessels, and gut lining. Collagen is 30% of total protein, and glycine serves as a neurotransmitter. We all know these ones. And skin is last of the priority for the body. And internal competition for the distribution of nutrients and lack of resources at skin level are so low. And the importance of amino acid supplementation are lifestyle choices, stress, we talked about this, they are external stressors, urban modern life as we all live all days, and genetic discrepancies and low priority of skin for resource allocation. We all need these amino acid supplementations for the final result, for the final collagen production. First, we must understand the collagen structure. Collagen is a key component of skin, and 70% of the dry weight of the skin is collagen. By the way, hyaluronic acid is only 1.3% of the skin. Collagen is made of amino acids. Collagen has an usual and very specific amino acids composition and sequence. Its glycine is found in every 3 amino acids. Proline makes 17% of the protein. And glycine gives a flexibility to linear amino acid chains, and proline and lysine is the triple gets the triple helix, and hydroxyproline and hydroxylysine are the components of, and we need these hydroxyforms for building good collagen. How to build good collagen for skin? Adequacy of type and number of amino acids, continuous availability and presence of amino acids in a specific ratio, and presence of cofactors like vitamins and minerals we need. And what do amino acid functional clusters do? They cause multiplication of fibroblasts, and they cause stimulation of collagen synthesis, and they cause production of growth factors, and they cause decreasing speed of the collagen degradation. What do we know about Jadipro? I know that you all use the first 2 products, amino acid replacement therapy. Jadipro provides an optimal amino acid functional cluster for collagen neosynthesis, and Super Hydro is needed for especially skin biorevitalization, structure, density, elasticity, and lifting. Okay. It's the unique formulation for optimal collagen neosynthesis. Actually, according to my experience, I can say that the hyaluronic acid is not our goal or is not our main component for this Super Hydro product. The amino acids are more important for us for getting strengthened to ligaments and activity of fibroblasts and production of new collagen fibers. So Super Hydro, you will see at the other slide, Super Hydro has a unique formulation for these amino acids. And the results are activation of a metabolic processes, restoring the normal structure of the epidermis, improving and supporting tissue nutrition, physiological rejuvenation of collagen, skin and face structure, and natural results. There are 2 forms. One of them is Jadipro classic form, and the other one is Jadipro HMW. Classic form is low molecular weight hyaluronic acid, but HMW includes high molecular weight hyaluronic acid. And Super Hydro, it has amino acid cluster modified peptides, and both of them low molecular and high molecular weight. How do you prefer? Actually, I want to learn your opinions. How do you prefer your patients for using Jالپرو classic form? Can you please answer it? According to age or according to the patient, how do you prefer, or in which patients do you prefer to use Jالپرو classic form? Yeah.
Classic form is more better for the dehydrated skin,
Mm-hmm.
and without the aging, and H&W is better for the age skin.
Yes, you're right. And I also trying to, of course, it depends on the patient, but if the patient is young and if we need more pre-rejuvenation, I prefer classic form under the 30s. But if a patient is older than 30s, I prefer HMW form. Or sometimes if I'm combining this treatment with golden needle radiofrequency or laser therapies, that's my observation. HMW increases the collagen stimulation more. So while doing these procedures, I prefer HMW rather than classic form. Classic form includes 2 ampoules, and we are mixing them and we are performing it to patients. And HMW has 1 shrink, and we are again mixing it with hyaluronic acid and amino acids, and we are injecting it to the patient. But that's the star of today. I think we must talk more about Super Hydro. Super Hydro has 7 amino acid functional clusters for collagen production and 3 biomimetic peptides for immediate fibroblast activation, and low molecular weight hyaluronic acid and high molecular weight hyaluronic acid for deep and lasting hydration. Super Hydro consists all of them. How can we make in courses? As I said, Jالپرو classic form includes low molecular weight hyaluronic acid, and HMW consists of high molecular hyaluronic acid, and Super Hydro, both of them in addition, amino acid peptides and chains, and peptides. We can perform the classic form once every 1 to 3 weeks, 4 to 6 times the classic form, and once every 2 weeks HMW form 4 to 6 times, and Super Hydro is less than them. Yes, it's a little more expensive product than HMW and the classic form, but it includes both low molecular and high molecular hyaluronic acid, and it needs 3 injections. So with 1 month interval, so it's actually approximately costs are similar. And additional, if needed, 1 month later we can do it after 3 injections. And there are numerous clinical studies support Jالپرو efficacy, but I know we are so tired and I won't talk so much about the studies. Just I can show the results that these studies show that specific amino acid formulations as substrates to collagen synthetic pathways may have a positive role in improving the aging signs of the skin, but they are already former studies. I think the new products like Super Hydro will affect the new studies and new results. We can see, according to the studies, it's an Jالپرو classical forms. It's at the end, intermediate visit, final visit, and additional visit. There's an improving of the skin quality, decreasing the nasolabial folds, and there's a lifting effect. And the other study, about after amniotic replacement therapy. It shows the change of the skin on the positive side. But what are our contraindications, precautions of use? Firstly, pregnancy and breastfeeding. Have you ever done to any cosmetic procedure? I don't think, because all the dermatologists are, actually I am, and a little obsessive people. So we don't want to make procedures to patients like pregnancy or breastfeeding. Especially breastfeeding patients come and really beg a lot for doing any treatment or any cosmetic procedure to themselves, but it doesn't need. It's not emergency. So I don't prefer anything except PRP treatment or like golden needle radiofrequency. I don't prefer to do anything to breastfeeding patients. And presence of other systemic pathologies like autoimmune disease, liver and renal insufficiency, and use of permanent feeders in the past. Condition after anti-cancer therapy during 6 months. This condition is important, I think. I checked all the literature about this. I don't think there is a guideline about the cancer therapies, after the cancer therapies for us. What can we do? Or when can we begin the Botox or fillers or these therapies? When can we begin? But it's clear that there are some Botox literatures on the PubMed, and it says that Botox is safe if the anti-cancer therapy is finished and if the patient is stable after 6 months, you can do. Of course, if the oncologist says, approves the treatment. And PRP treatment, they look at especially for breast cancer patients. And when they do PRP, especially to sentinel lymph nodes, they had seen that there is no recurrence or there is no risk for nukes or other signs of the cancer. So they say PRP is also a good option. And we can do hyaluronic acid therapies. They say, the literature says that hyaluronic acid therapies are safe therapies for the cancer patients. If they finish the cancer therapy, but there's an exception for breast cancer because sometimes they use the treatment all the time, like tamoxifen. They say hyaluronic acid treatments are also can be useful, or they don't give any harm to the patient after if the patient is stable after 6 months. And the other condition is hypersensitivity of the product components, and taking non-steroids and systemic steroids is another contraindication. When can you use Jallipro? Yes, this is a slide, but I think our experience is more important. All of us have the patients like, oh no, doctor, I don't want any Botox, I don't want any fillers, but I want something, let's do something to my face. I don't know why, but some of the patients are really getting afraid of the procedures. So when I see a patient like this, and if there is a volume loss and if there is a dehydration, I always prefer Jallipro because it's safe. And you can tell the patient easily that it's a kind of smart mesotherapy, it's not a filler, there is no cross-linked, so you can be relax and don't worry, and it's safe. And in younger patients, if there is dehydration, if there is fine wrinkles, yes, we can use Jallipro. And for photoaging and anti-aging to restore healthy skin with collagen booster, deep nutrition and hydration, and to prepare the skin before other aesthetic procedures. I always see the effects when I combine it with fractional laser therapies and golden needle radiofrequency. They both increase the collagen stimulation effect. And for scars healing, keloids or stretch mark treatments, we can use them. For younger patients, for rejuvenation, we know for deep hydration, for acne scars correction, yes, acne scars correction is another option for us with golden needle radiofrequency and fractional laser therapies. We can use it safely at these patients and for collagen banking. And from 40s, rejuvenation for photoaging, anti-aging, for fine lines, and for hydration, we can use the Jadipro products. And in combination with other procedures, I told about this. Treatment plan and injection protocols, when we look at this, we can use it face, neck, décolleté, underarms, hands, inner thighs, and abdomen. For classic form and for HMW, the depth must be at the dermis, and techniques should be micropapillus, linear, fan shape, grid shape, and mixed it can be. And we only need 30 gauge needles. When we look at this slide, it's important because in our clinical practice, we use 4 millimeters or 30 millimeters needles. If we stay at 1 millimeter, first millimeter, we are staying at just the epidermis. If we are going deep, like 4 millimeters, we are in dermis. But if we are using more than 4 millimeters, like 30 millimeters, yes, that's our purpose, that's our goal. We are under the dermis. Especially, I will talk about the super hydro. We need this depth. From 1 to 4 millimeter, according to the area of face, it shows the breast low depth. And the angles are important because if we give the angle like 15 degrees or 10 degrees, or if we are making papillus, we are superficial. Yes, it can be used. We are intradermal also. We can use it for Jadipro, HMW, and classical forms, but we can't use it for super hydro. For super hydro, we must be deeper. Our standard protocol for Jadipro classic form is 1 to 2 weeks treatments. First, second, third, and fourth treatments we can do. One of the option is repeat full protocol twice a year. The other one, boost protocol of 4 injection with maintenance injection every 2 to 3 months. And HMW 4 to 6 injections according to skin need. The intervals can be 2 to 3 weeks, up to 3 sessions, and one of the option again twice a year, and the other option boost the protocol. But this is the slide. This is not the truth, actually. There are only patients and us at the clinic, and we are making the protocols according to the patient's need. If the patient needs, I can add one more to 4 treatment for classic form and 4 treatment for HMW. This is just because they don't give any harm, or they are not. This is the base treatment, but the important thing is the patient's needs, so you can increase the therapies according to the patient's needs. Face and neck, we can talk about those skin Jadipro classic form. The intervals would be shorter, like 10 days. We can do 4 sessions. For forehead, barcode, marionettes, nasolabial fold, oval correction, and neck, the intervals should be 20 days, and we can do 3rd session. But as I said before, this is just a slide, and this is just a base therapy. The important thing is the patient's need. And how to distribute the product. When we look at classic form is 1 milliliter for forehead and 1 milliliter for cheek. And when we look at the HMW, 1 milliliter to cheeks and 1.5 milliliter for forehead. We can distribute. We can do micropapule technique by using a short needle, Jadipro classic form papule every 1 to 5 centimeter, evenly distributed on the face. And HMW papule every 1/2 centimeters, evenly distributed on the face to deep dermis. And we can do a micropapule technique by using a needle 30 or 32 gauge. And 32 gauge needle will allow more points of injection with smaller quantity per point. Here we can see the micropupil technique. And we can also do linear retrograde technique for face by using a long needle. We can do it by giving an angle and retrograde injections for also HMW and classic form. But actually, Jالپرو is not a cannula product. We should do it by needle, because by the needle we can know the depth, we can know where we are putting the product in the skin. So I can recommend to you not to use cannulas, we can use needles. And the boost protocol increase amino acid amount for increased efficacy. Several damaged and dry skin who need extra boost, we can mix classic form and HMW form, and we can inject the mixed form to face, neck, and décolleté, and we need just 30 to 32 gauge needles. And for neck injection, start on the horizontal lines. We can begin inject on horizontal lines with pupil every 1.5 centimeters. What can we use? Classic form or HMW. But in my routine clinic, I prefer HMW form for neck lines. I think it's more effective for necklines. And we can see a before, after photo after the Jالپرو. This is HMW. And for the décolleté, we can draw a triangle firstly, then we can draw a grid on décolleté triangle and inject on each square. We can again use classic form or HMW form, but I prefer the HMW form again for décolleté. And there's a patient with HMW before and after photos. Yes, we can use it everywhere. On hands, on underarms, on knees, on tummy. Do I have a patient like this? Actually, sometimes patients can complain very strange things like knees, like tummy, or for citrias. At these options, at these conditions, sometimes we can find need a product that we can mix it with other treatments like device-based treatments, or sometimes if we don't have a device, then we can just give the classic form or HMW form safely to these areas. Of course, are they so effective on these conditions? There is no clear-cut condition for strias, or there is no clear-cut therapy for tummy, but they increase the efficacy, both classic form and HMW form, but I prefer HMW form in these conditions. And for hands, it's 4 sessions with 20 days intervals and volume injected according to aging severity. Standard 1 to 25 milliliters per hands, and efficacy boost, we can mix the both forms. We can do micropapilla, we can do linear retrograde, we can do cannula at hand. Yes, Jالپرو is not a cannula product, but for hand we can use the cannula. This is an HMW before and after. And we can mix the Jالپرو and PRP. Sometimes the patients can say that I don't want anything from the other side, or I don't want feeders, I don't want anything, I just want my own therapy like stem cell or like PRP. We can do, if we need volume, we can do, and we can mix the Jالپرو to PRP treatment. It's a safe therapy. The intervals are 10 days, and we can do up to 5, and we can also do classic form, mix the Jالپرو classic form to PRP treatment. And we can use it in combination with all procedures to optimize the results. Combined treatments For aesthetic procedures, there are stimulation treatments and there are replacement treatments. Stimulation treatments are peels, fractional laser, radiofrequency, HIFU, IPL, and replacement treatments are volumizing injections, synthetic implants, threads, stem cells, lipofilling, and Jالپرو. And the addition of the stimulation and replacement therapies gets us to the result. And of course, the food is important, stimulation. The addition of this food and stimulation affects our result. Combination therapies, we can combine it to peels, to feeders, to PRP, to fractional laser, to IPI, to radiofrequency, to HIFU, and to plastic surgery treatments. And let's look at how can we combine them. For HIFU, actually, I'm also curious about, in your clinics, which devices do you prefer in Iran? What's the more trend device treatment? Can I get an answer, please? Fractional laser. HIFU. And golden needle, how is golden needle? In Turkey, I can say that golden needle radiofrequency and HIFU is getting a more trend. And by this time, I can say that fractional lasers a little get decreasing because it's a very specific to winter months. We cannot do it all the year. So I think that's my observation. HIFU and golden needle radiofrequency devices are more sold in Turkey. And when we look at the combination treatments with energy-based devices, we can do the classic form before 2 to 4 weeks procedure. And then we can do the procedure. It can be laser, HIFU, or radiofrequency. And after procedure, we can do again classic form with intervals 10 days. We can add, and it gets strength and efficacy. At home, we can give the other products. But especially for golden needle radiofrequency, when we do the treatment and when we make the tunnels on the skin, I give the especially HMW form to deep folds deeply, and when the tunnels are open with golden needle radiofrequency, at least I apply the HMW form to the skin. And I say you will stay like this till tomorrow morning. And it really increases the efficacy, especially for acne scars and for anti-aging. And Jالپرو and microneedling result, there is a photo of 1 week after the procedure. Scar subcision is made here, Jالپرو made here, and microneedling made here. And for carbon dioxide laser, 2 Jالپرو injections, 2 weeks and 1 week before the laser, then the carbon dioxide laser skin resurfacing, and after 1 month we are continuing the injections. And when we look at the patient, we can see the better results after the laser skin resurfacing. It's demonstrative. At the first peaks, all the patients really get so scared and send you lots of photos. And is it right? Is it right? Is there a problem? And we always say it's true, it's right. Please calm down. And finally, the skin refreshes itself, and the laser skin resurfacing and Jالپرو products increase the efficacy. But at these conditions, I also prefer HMW form. And for IPL combination protocol, Jالپرو 3 intradermal implants starting 1 week before IPL, then after the IPL treatment, after 3 weeks, we can do another treatment. And for fractional laser, 2 intradermal implants, 15 and 30 days before laser, and 6 intradermal implants monthly between the treatments. This is another treatment patient with Jالپرو and IPL, and this is Stria with fractional laser and HMW form. And ultrasound lifting combination protocol before HIFU, JDPro 2 intradermal implants before 15 to 30 days before procedure, and after HIFU 4 to 6 intradermal implants every 14 to 30 days after treatment. And there are results before and after 2 injections of JDPro and pulse-dye laser. For example, pulse-dye laser is really very rare in even Istanbul. It's actually found in maybe 2 or 3 centers. It's really very rare. And results after, at the right side, after 2 injections of JDPro and microneedling therapy for acne scars. And how to do before surgery and after surgery. 3 injections of JDPro Classic on the face and on the area to be cut, 7 days interval with the last one. 3 days before surgery and 1 week before surgery, JDPro food supplement. And after surgery for facelift, start maintenance protocol injections on the full face after 1 or 2 months according to healing process. And before surgery, as I told, 7 days intervals, and body surgery, 7 days intervals, and before surgery, at the last 3 days, stopping the treatment. And after the surgery, we can do maintenance therapy. And of course, we can add food supplements, additional vitamin C, and increase overall protein intake, especially organ meat, and limit sugar intake for 3 weeks, and we must stop the smoking. And after 1 month, start maintenance protocol. And combination protocol for lipofilling and stem cells injections. We know that fat pads are made of adipose cells and connective tissue, and providing the microenvironment for cellular components to interact with. ECM is an important component of adipose tissue, and using the benefits of JDPro on connective tissue in combination with fat grafting helps improve implementation of the adipose cells. And how can we do it? 7 days before we can lipofilling and stem cells injection, we can do JDPro injections. And after the therapy, stem cell or lipofilling, we can begin again for additional benefit. We can begin maintenance the protocol 1 month intervals. And threads, JDPro 3 intradermal implants before surgery, before threads, and after threads, JDPro we can do 2 to 4 intradermal implants weekly after at least 15 days. There is a thread patient, the same patient, and that's the star of tonight. Especially, we want to talk about Super Hydro today. It's not actually a skin booster. It supports ligaments and deep connective tissue. It's the difference. Its difference from the other products is this one. It supports the ligaments, and we must know the anatomy to identify face ligaments, and it's really important. And as I told before the slides, you must be deeper for injection, for supporting the ligaments, and for finding the ligaments. Which ligaments are our purpose in this treatment? We can say that by aging, with aging, retaining ligaments become loose due to collagen degradation. And which ligaments? Next to orbital retaining ligament, on the zygoma, zygomatic cutaneous ligament, mandibular septum, platysmal auricular fascia, and masseteric ligament, and upper masseteric ligament, and chin are goals in this treatment. When we look at the connective tissue of the face, we can see the ligaments. I will show you with more details at the other slides, which ligaments are we aiming for this treatment. Again, we all know the superficial muscular aponeurotic system, SMAS, and we know the importance of SMAS. And there are retaining ligaments. There are 2 types of ligaments, true ligaments and false ligaments. True ligaments are easily identifiable structures that connect the skin to underlying periost, and they are our aim. Under the eye, there is a tear-through ligament, and tear-through ligament continues with orbicularis retaining ligament. This is the first RA ligament, and zygomatic cutaneous retaining ligament, and mandibular retaining ligament. The other name is mandibular septum, and masseteric retaining ligament, upper masseteric ligament, and lateral cheek septum are platysmal auricular fascia are aims for this therapy. And ligaments are aging as well, becoming more loose due to collagen loss and fragmentation. And we all know there are fibroblasts in ligaments in need of resources. The primary cell types of tendons are fibrocytes and fibroblasts. Tenocytes are mature tendon cells that are found throughout the tendon structure, typically anchored to collagen fibers. Tenoblasts are spindle-shaped. They are the immature tendon cells that give rise to tenocytes. Tenoblasts typically occur in clusters free from collagen fibers, and we are just trying to do this. How can we support the ligaments? We are trying to give rise to tenoblasts and fibroblasts via especially amino acids and peptides. They are highly proliferative and are involved in the synthesis of collagen and other components of the extracellular matrix. And when we look at the injection plan, we must be secondary optional injection plan. It's almost on the periosteum. We mustn't stay superficial. If it stays superficial, we cannot do the right thing for this treatment. We must be near to periosteum and near to retaining ligaments. And injecting super hydro in the retinacular cutis stabilizes fat pads. We know they are made of adipose cells and connective tissue, and maintaining collagen health improves the structure and the maintenance of fat pads for a younger looking face. Yes, that's important. I will show you the points, but the important thing is 6 points. There are 6 points at the right side of the face, there are 6 points at the left side of the face, and there is 1 point on the chin. To the chin, when we look at the product, it's 2.5 milliliter injection and 0.2 milliliters for the other 12 points, and for the chin, 0.1 milliliter product. For orbital thickening, platysmal auricular fascia, masseteric cutaneous ligament, and mandibular septum, and zygomatic ligament, and upper masseteric cutaneous ligament. What should we do? I have never seen a patient causing necrosis or occlusion with this product. I have never seen. But I'm always trying to be careful. I'm always doing retrograde injections if I'm near to a vessel or for avoid any risk. I always do retrograde injections like how we do as fillers, and we must really know the ligaments and where to put the product is important for this treatment. But I must add, in this product, I have never seen an occlusion, and I have never seen a complication like this. This is our nurse, and I wanted to show, I will show the video with her. At the second, this is just after the photo. We can see both of the cheeks lifting, and I can especially observe the under eye. I didn't do anything to under eye, but her under eye gets lifting, and the darkness decreases by the only super hydro injection. This again, one of my patients. After the right side injection, we can see the lifting, but there is no injection to the left side, and there is sagging, and we can see the best, I think, thing for this product, that we can see the effect immediately. Of course, what we put to the skin would get lift, but when we look at the time by time, like 4 weeks and 8 weeks, we can see the permanent effects and permanent lifting at this patient. That's why we are always saying it must be with 4 weeks intervals. That's again one of my patients. This patient didn't want any filler. She just says, do something to me. I have just 1 day. I can't come more and do something to me. And I said, okay, let's super hydro time. And especially her nasolabial folds were significant. And when I made the injection to right side, the nasolabial fold decreased by the injection. And this is 1 month after injection. Collagen production reinforces the lifting effect. And super hydro course protocol, how? Stand-alone treatment ligaments, 1 month interval, 3 sessions. And if we are combining it with HIFU, 1 month intervals, before HIFU 2 sessions, and after HIFU, after 3 months, 1 session. Precautions and contraindications are the same: Hashimoto disease and thyroiditis, patients prone to swelling and allergy, injection of high quantities in regions prone to swelling and risk of edema. The amount of hyaluronic acid is really high, so it might attract a lot of water in some patients, leading to edema, and filler injection less than 4 weeks before. And I must again say, this is not a clean product because we are using it clear-cut points. So except place the product on the ligaments, do not use cannula for fanning technique. And there are advanced protocols for super hydro. You can do everything with super hydro according to the patient's need. If a patient has fine wrinkles, you can be at these areas. Firstly, deep injections, then more superficial injections. You can do it. Just, of course, it won't give all the lifting effect, but according to the patient's need, we can do also it as a mesotherapy. And there are also, we can increase 10 superficial points for each side, 5 deep points each side. At this deep points, we decrease the amount, and we add 10 superficial points for each side. And first session, there are another advanced protocols for super hydro. First session, second session, third session, and we can do anything how we wish and how the patient wish. We can do the other techniques as advanced protocols for super hydro. Patient analysis is important. Defining needs and treatment options and talking with the patient is so important, and planning protocols is important. Super hydro can be injected in the hands, again needle or cannula. And when we look at the face, a full face approach, how can it be? We can support the ligaments with super hydro. For eye area, it's classic or young guys. I prefer young guys. In Turkey, we can find the young guys. I'm not sure if it is found in Iran. And for mid-face, HMW. And I can talk in myself. I'm 38 years old, and I don't like, for myself, fillers like the other patients. Sometimes the patients are like this, and I would like to do something to my face for prejuvenation and rejuvenation, and I made super hydro and young eye at the same time. And after 1 day, there was a little swelling, but I can do everything because it doesn't cause a very severe edema. And I combine it young eye and V-lift for my face, and I'm happy with the results, I can say it. And when full face approach, we said that super hydro is 1 month intervals for 3 sessions, and At these times, we can add classic and HMW form at the middle of the sessions. And when we look at the injection, HMW and classic forms are superficial injections, but super hydro, you must be, for lifting effect, you must be deeper. And there are amino acid replacement therapies as optimal collagen production thanks to its specific amino acid cluster for classic form and restriction of the face and youthful appearance for HMW form. Thank you for your attention. I want to thank all of you, and if you have any questions, I would be so happy to answering them. These are me, and these are Jالipro. Thank you. Now, we will perform it for the patients here, but firstly, I want to show one video. We recorded it in Istanbul, and I draw the patients. I want to show it to you.
Hello everyone, I'm Dr. Fatma Pelin Özgen. I'm dermatologist from Zorlu Memorial Wellness Clinic. Today I will show you how to use Jالipro Super Hydro V-Lift, and let's begin the treatment. Why do we use Jالipro Super Hydro treatment? It's because of getting strengthened of the ligaments of the face. We perform this product to 6 points at the right side, 6 points at the left side, and to the chin. Totally it's 13 points. And as you can see, when we open the box, this is our product. It's 2.5 milliliters. And there is no needle in the package. First, I would like to show you the points of the face. How do we find the ligaments of the face? The first one is the 2 centimeters lateral side of the lateral canthus. Here, this is for orbital thickening. This is periauricular ligament. And the second point will be zygomatic ligament. You can also feel the zygoma. It's on the zygoma, and it's at the 2 centimeters lateral side of the sulcus. Here we can find the zygomatic ligament. And the third point is the platysma auricular fascia. We can find this on tragus, 2 centimeters medial side of the tragus. This is the platysma auricular fascia, and on the gluteus, here we can find our fourth point. That's the mesenteric cutaneous ligament. And the fifth point is on the marionette line, and on the chin, we can find our fifth point. Here it is mandibular septum. And the last one is 2 centimeters from the nose. Here we can find upper mesenteric cutaneous ligament. These are the 6 points, and on the chin, that's the 7th point. The same points will be the other side of the face. And how do we perform it? It's with the needles. The needles must be 30 millimeter, it can be 30 or 32 gauge. You must fix the needle, and after we see the injection, it's not so fluid. You can see it's not so aqueous. It's less than a filler, more than a mesotherapy. And let's begin. For all the areas, firstly you must check the piston, and you must stay superficial. the retrograde piston. There is nothing, and 0.5 0.2 milliliters for the first point. For the second point, zygomatic ligament, the same. First retrograde. Let's check. .2 milliliters, and for the third point, fourth point, fifth point, and the last point for the right side of the face. You mustn't be at superficial layers. You must be deeper. And the last point is chin. First retrograde, then 0.1 milliliter. Yes. Oturalım şimdi. Şu karşıdan çekebilirsin. You can see the lifting effect of the right side of the face with V lift. Right side had finished, and now we are beginning to the left side. Tamam. Bundan sonrası ben buraları çekebilirsin öyle. We finished all the injections. It's approximately 5 to 10 minutes procedure. And after the procedure, there can be a little bruises or some ecchymosis, but it will all gone in 2 to 3 days. And after 1 month, we recommend to do one more session. You can see all the lifting effect and all the patient is so comfortable and we can see the lifting of her face, but the effect will be more clear and more definite after 1 month. Thank you.
Thank you. I think this video is more easy to watch and to make the explanations, but if you have any question, I can answer them with happily. Sorry. Time to rest. Okay, let's have a coffee break. Thank you. Beginning the treatment now. First we cleaned the face and now I'm making markers for the face. The first point is for orbital thickening. It's the 2 centimeters. We are firstly finding the lateral canthus and 2 centimeters lateral side of the lateral canthus here. And the second point, firstly you can feel the zygoma and it's under the sulcus tear-through, 2 centimeters on the zygoma and under the sulcus, 2 centimeters, second point. For the zygomatic ligament. And third point on the tragus, 2 centimeters medial side of the tragus. This is platysma auricular fascia. And fourth point we can find on here on the mandibula. It's the fourth point. That's for the mesenteric cutaneous ligament. And on the marionette line and on the chin, we can find our fifth point. That's for the mandibular septum, fifth point. And from the nose, next to nose, 2 centimeters medial side of the nose for the nasolabial folds is the sixth point. And the seventh point is on the chin. Let's do the same thing for the other side of the face. First, we are finding the lateral canthus and 2 centimeters lateral side of the lateral canthus. First point for orbital retaining ligament. And second point, we are finding the zygoma under the sulcus 2 centimeters, zygomatic ligament. And third point is 2 centimeters medial side of the tragus, platysma auricular fascia. And fourth point for mesenteric cutaneous ligament, here. And fifth point on the marionette line and on the chin for mandibular septum. And 2 centimeters medial side of the nose for the upper mesenteric cutaneous ligament. These are our points.
May I ask a question?
Yes.
About the first point, is it important the distance between this point and the lateral rim of orbit?
Yes, yes. For the lateral canthus and lateral rim of the orbit, and at all the points, I will do. You will see my injection. I will do first retrograde injection for that. Like I said, I had never seen an occlusion problem at this product, but even in all cases, we have to take care for this complication and first retrograde injection. And our first point for orbital thickening, it's orbital retaining ligament. We must find it. And it's 2 centimeters lateral side of the lateral canthus, yes. Orbital rim. It's not in the orbital rim, actually.
In the young patient, it's no problem because the lateral canthus and the lateral rim of orbit are in the same side.
Yes.
In the aging patient, maybe there's some difference, some resorption of the bone. And is it, again, in this condition, 2 centimeters from that lateral rim of the inject?
2 centimeters of the lateral canthus is the more appropriate place, but for the older patients, you can add 1 more centimeter to lateral canthus, okay?
Thanks so much.
You're welcome. Okay. And the product, there is no needle in this product. It's 2.5 milliliter product. Four millimeter needles are too short. We mustn't do it with 4 millimeters. At least it must be the appropriate millimeter is 30 millimeter. I can get the gauze. Sorry, I couldn't hear. Yes, the cream was applied approximately 40 minutes ago. You ready? Yes, I'm beginning. As I told you, you mustn't stay at the superficial layers, so you must be a little deep. First retrograde. And very low. Injection, yes. You okay? Okay, I will tell after I finish. Now the second point is on the zygoma for the zygomatic ligament. When you feel the zygoma, it's approximately 2 centimeters lateral side of the sulcus. I'm always watching the amount. 0.2 milliliters for the first 2 points, and third point, please return your face. Turn your face. First retrograde injection again. And fourth point, are you okay? Please say something. Our patient. I think she's okay. Yes. Can I get one more clean gauze? With some sterile. That's our 4 point. First retrograde. Fifth point. retrograde injection. And the last point of the right side. For the upper masseter ligament. And now to the chin. When I make the retrograde injection for also the feelers, I count to the 10. And for the chin, it's 0.1 milliliter. Yeah. Would you please come and clean the face and apply the cream, and we can change the needle. I changed the needle to the other side of the face because we are going to deep layers, so it gets cured and the patient can feel the pain. At the other side, I always change the needle.
Which side of needle do you use before?
It would be 26, 27. For especially retrograde injections, you can feel yourself more safe with 26 or 27 gauge. But you can also use 30 gauge. But when you use 30 gauge needles, it can be hard to give the product. So 26 to 27 are you can more easily inject. Can I go to other side, or do I have to stay at the side? Okay.
Please train the ice cube because the first time here, ice cube
Okay.
is a new product.
Okay. I can get one more gauze. What can we do? Marker is okay. We marked it. Oh. Can you sit, please? Can you sit, please? Here we finished the right side, and we can see the decreasing of the nasolabial folds, also lifting effect on the right side. This is just immediate effect because of the hyaluronic acid, of course, but in 4 weeks we will see the effects also of amino acid and peptides, and it's more important for us because our aim is supporting the ligaments here. Yes, you can lay again. Thank you. After just one injection, it's hard to say, but according to my observations, I can say, I can especially observe myself. For example, the effect lasts in 3 months if you do one session. But I'm a middle-aged patient, so it can be less for older patient. That's why we recommend the 2nd and 3rd sessions. It would be more, but for combining the products, I prefer, for example, first the fractional laser and HMW. Then after 3 sessions, if I have time and if the patient has time, I made one V-lift after 3 sessions of HMW, for example, because combining treatments that that's my protocol actually. When I'm combining the treatments, first I prefer HMW because V-Lift is a very special product for its ingredients like amino acids and peptides. So yes, you can combine it with all the devices, but I prefer HMW. At the end of the sessions, I made V-Lift. Yes, I always do subcision and radiofrequency and Jالپرو at the same time. At one session, I do all of them. And with 3 sessions or 3 weeks, 3 sessions, I combine all of them again. Subcision, radiofrequency, golden needle radiofrequency, and Jالپرو. First, again, retrograde injection, counting till 10. And now our second. That makes my work hard. Can I get it? This. And the second point is on the zygoma, zygomatic cutaneous ligament. First, again, retrograde. .2 milliliters for the second point, and for the third point, .2 milliliters again. Fourth point, and the last 2 points. And the last point. Sorry. Making it. Here we finish the treatment. I always tell the patients that you can feel some swellings under your skin for 2 to 3 days, but they all solve under the skin. And do I recommend anything except washing the face for the first day? I don't recommend anything. And it's a safe and easy application. As you see, now it's with lights, camera, it takes almost 10 minutes, but according in your clinical practice, it gets only 5 to 6 minutes. And as I told you, if you get your attention to product and to the procedure, I have never seen any complication. And if you choose the patients accurately, you can get good results with this product. Thank you. Lip. Lip is recommended with classic form and HMW form. You can use it for the lip. But for super hydro, there is no indication for lip augmentation. But if you want to do something for the lips, you can use HMW with 2 to 4 weeks intervals. 3 sessions, yes. You're welcome. I will show you again the first orbital for the orbital thickening. Orbicularis retaining ligament, 2 centimeters lateral side of the lateral canthus. You can feel the zygoma and 2 centimeters lateral side of the sulcus and 2 centimeters medial side of the tragus. 3rd point, 4th point, chin. And on the marionette line, 5th point. And on the nasolabial fold, 2 centimeters medial side of the nose, 6th point, and the chin. Now for the other side, again 2 centimeters lateral side of the canthus after feeling the zygoma. And 3rd point is 2 centimeters medial side of the tragus. 4th point is on the gonion and marionette line and chin. And 6th point, 2 centimeters medial side of the nose. Let's begin. Can I get the sterile gauze with? First point, there is nothing on the retrograde injection. Sorry, I couldn't hear. I will answer. Eyebrow lifting. If you give it to temporal fascia for the advanced techniques, yes, it may cause a little bit eyebrow lift, but I think it won't get the patient's needs accurately. But of course, for the orbital retaining ligament, when you inject, eyebrow lifts a little. Second point and 3rd point. Are you okay? Fourth point. And fifth point. Okay. Okay. And the last point of the right side. And to the chin. Can I get stericals? And to the chin. .1 milliliter. We can clean this face and change the needle.
Generally, do you apply anesthetic cream or you inject patient without any?
Sorry?
Generally, do you apply anesthetic cream before?
Yes. Before all the procedures, especially and before this V-lift and Jالپرو HMW, I prefer applying cream approximately 30 minutes before the procedure. I can get that. First point. Are you okay? Mm-hmm. Finishing. Okay? Yes. Okay, to the cheek. Third point. Fourth point. Okay. Finishing. Finishing. Point. And last point. Yes. If you know the anatomy and if you know the true points, you can see that there is only a little bleeding and they don't cause any bruises or ecchymosis. But I can say that if you cause any ecchymosis with Jالپرو lift product, it really dissolves in 2 to 3 days with arnica gels, or first if you apply the ice cubes. There is less bleeding in this product, and I should always say that the injection technique must be slowly, like as our all feeders. And if you are doing this lift product like feeders, try to do it not late hours on your clinic, because at the late hours our attention is getting less, and I always give the appointment schedules for early hours or in the afternoon with V-lift and the feeders, because sometimes you can lose your attention, especially in the evening, so you may harm the patient. Therefore, the injection technique must be slowly and prefer to be in the morning or in the afternoon. Thank you for your contributions and your attention, and thanks for the patience. We can clean the face.
Thank you.
You're welcome. Okay, where is the dinner? Time to dinner. It's time to dinner, so we are waiting all of you in the dinner hall.